Is eye bag surgery with fat repositioning a good procedure?
People considering lower eyelid surgery to treat puffy eye bags are often concerned about the potential for a hollow appearance after surgery. Some doctors try to ease this concern by saying that the fat causing puffy eye bags, instead of being reduced, can be repositioned to an area around the eyes where there is hollowing. As a cosmetic eyelid surgery specialist, I have experience with this procedure as well as performing revision surgery for people who had fat repositioning surgery performed elsewhere. I'll explain how I help my patients who express a concern about potential hollows after lower eyelid surgery and what the risks of fat repositioning surgery are in comparison to alternative options. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform upper and lower eyelid surgery pretty much every day in my practice, as well as revision eyelid surgery to correct work originally performed by other doctors. I also perform routinely non-surgical eyelid procedures such as laser resurfacing, fillers, and platelet-rich plasma or PRP. Puffy eye bags that are present all the time regardless of sleep, allergies, diet, or sinus issues are caused by fat. The fat that normally surrounds and cushions around the eyeball can push forward, resulting in visible bulges under the eyes and is referred to as lower eyelid fat prolapse. The most definitive way to address the appearance of eye bags is to sculpt and reduce the fat causing these bulges. Sculpting and removing fat from the lower eyelid is done surgically with a procedure called lower eyelid blepharoplasty. The most common performed procedure is called a transcutaneous blepharoplasty, where fat is sculpted and removed through an incision made underneath the eyelashes. A more specialized and technically advanced procedure, which I prefer, is called transconjunctival blepharoplasty, where there is no external incision and the fat is sculpted from the inside of the eyelids. The transconjunctival method is advantageous for the patient as there is no outside incision. Since I perform this procedure from the inside of the eyelid, I'm preserving and protecting the delicate muscles and support structures of the lower eyelid. I'm able to therefore minimize the risk for common complications such as the eyelids being pulled downward or rounding, which is referred to as lower eyelid retraction. I've found that for many people the definition of hollowing is the appearance of lower eyelid retraction. This makes sense, since when the eyelids are pulled down, the look is drawn or hollow. Frequently, people with eye bags have hollowing in other areas around the eyes, such as the rim of the eye socket or the upper cheek. A doctor may offer lower eyelid blepharoplasty with fat transpositioning to fill this area of the tear trough and the adjacent bony rim. During surgery, what's called a pedicle of fat, which means the fat is still connected to the blood supply from the eye socket, is moved over the rim and sutured into the area. Some doctors cut the fat and place it in there and just suture it freely. This all may sound logical and intuitive, but it is generally actually problematic. Why? First, the eyelid skin is very thin, so the area can easily appear lumpy and swollen. The blood supply, by being bent over the rim, is effectively compromised, which means the fat can swell, similarly to the way your arm would swell if you left a tourniquet on too long. The bending or kinking of blood supply can also deprive the fat of oxygen and nutrition, which results in the fat dying. This repositioning concept is not new. In oculoplastic surgery, this concept was being explored in the mid to late 90s. At that time, we didn't have hyaluronic acid fillers. Further, the doctors who were strong proponents of this procedure initially later stated that they were no longer performing fat repositioning. This doesn't stop or didn't stop other doctors in other specialties to cyclically reintroduce this concept. In my opinion, it's more of a marketing tool than anything else. I've watched a surgeon who claimed to be a top expert demonstrate this procedure. He proceeded to remove 90% of the prolapse fat and take a small and insignificant fat pedicle for the so-called transposition or repositioning. Any experienced surgeon would know that the fat repositioning that was done by this doctor was not going to make any difference in the aesthetic outcome. Patients reported to me that when they come in to see me for a second opinion after fat transposition surgery performed elsewhere, that they experience prolonged swelling and lumpiness, which required steroid injections by their doctor. If there is one thing people have limited tolerance for these days, it's unpredictability. I approach rejuvenation for the under eye bags during consultation by also looking at the projection of the cheek directly under the eyes as well as the cheekbones. I look at the eyes and cheeks as a combination rather than looking at the eyes in isolation. It is commonly seen whether the cause is genetics or the cause is bone loss from facial aging for there to be a potential space under the eyes and cheekbones for volume enhancement. As a surgeon with experience performing tear trough implants and cheek implants, I apply the same principles to the application of longer-lasting hyaluronic acid fillers onto the bone structure, a method we call structural volumizing. I routinely use a filler like Juvederm Ultra Plus or Juvederm Voluma to enhance the cheekbones at the same time I perform lower eyelid surgery. As mentioned earlier, by maintaining the shape of the lower eyelid and avoiding the hollow look of lower eyelid retraction and also enhancing the cheekbones, my patients are very much satisfied with their appearance after surgery. If there is a potential benefit in adding volume to the tear trough later, we can always do that. Unlike fat transposition, hyaluronic acid fillers can be safely and easily dissolved if needed with an enzyme called hyaluronidase. Addressing the puffy eye bags is not a standardized procedure, and there is an art to achieving natural results. The goal is to have an appearance as if you never had bags under your eyes. I routinely perform transconjunctival lower eyelid blepharoplasty in my private office operating facilities using local anesthesia and light IV sedation. Our patients walk out of our office comfortably and return to work typically in 1 week. Although the concept of fat repositioning has a certain intuitive appeal, there is little justification for this procedure as it is often promoted, although not practiced as claimed in actuality. In my opinion, if you have under eye bags, a properly performed surgery combined with other procedures, such as the placement of fillers, can help you look better in a safe and predictable way. I hope you found this information helpful. Thank you for your question.